Hi, today's lesson we're going to focus on, does Parkinson's disease cause dementia? There's a lot of talk right now going on in regards to Michael J. Fox. Just be aware that he had early onset Parkinson's disease that was diagnosed at 29 years old. And through some very aggressive treatments, Michael has been amazing. I think he's now 60 years old. And with his diagnosis, he's just now starting to have some memory loss. So people are asking, does Parkinson's disease cause dementia? I'd like to first start with an overview of what is Parkinson's disease for those that aren't familiar with it. Parkinson's disease is a disruptive movement disorder that can severely impact daily activities like walking and even cause cognitive problems such as memory loss or dementia. While it occurs usually in those 50 years old and older, the average age for a diagnosis is around 60 years old. Although there are younger individuals who could be higher risk for developing early onset Parkinson's if someone in their family has also had the condition, as in Michael J. Fox of the Fox Foundation. Parkinson's disease affects more men than women, and it is a chronic and progressive disorder. Doesn't go away and continues to worsen over time. Parkinson's disease is caused by a lack of a chemical known as dopamine in the brain. And it's a very important neurotransmitter, or a chemical messenger, if you will. And it's responsible for helping us enjoy life, stay motivated and focused. It also plays a key role in how we think and plan. As the affective neurons or nerve cells gradually become impaired and are unable to send signals, the brain's chemical messengers, dopamine, decreases, leading to physical symptoms such as tremors, rigidity of muscles, slow or awkward movements, and even poor balance and coordination. Fortunately, there are treatments available today which help reduce those effects by restoring more than enough dopamine back in the brain. And Michael J. Fox is a perfect example of successful treatment. They can't stop it, but they can sure delay the progression of the disease. So developing Parkinson's disease causes disruptions in our dopamine levels. And this causes Parkinson's symptoms, such as the muscle stiffness and other movement-related symptoms. Low dopamine levels in Parkinson's affects mood and cognitive problems as the disease progresses. While Parkinson's itself does not cause dementia, it can increase the risk for developing dementia due to genetic mutations or environmental factors. In addition, both genetic and environmental factors such as advanced age, head injury, or exposure to certain toxins can increase an individual's risk for both Parkinson's and dementia. Genetic mutations associated with Parkinson's can also increase an individual's risk of developing dementia. In some cases, a genetic mutation can be the direct cause of the Parkinson's, and it will lead to dementia or may lead to dementia. So, what are the symptoms of Parkinson's disease? Parkinson's disease can have a variety of symptoms, from essential tremor to slow walking and stiffness in different areas of the body, like your face or legs. It has a slower movement and rhythmic shaking that often causes balance disorders. Other symptoms include muscle stiffness, coordination problems, and difficulty with writing. Many people don't seek help initially for the first signs because they're so mild. But as it gets worse, you're going to notice depression, gastrointestinal problems like constipation, difficulty with swallowing and chewing issues that can cause weight loss over time, and alongside memory loss issues or other symptoms like psychiatric symptoms like hallucinations, and then dementia. How is Parkinson's diagnosed. Diagnosing Parkinson's disease is very tricky. No one test can pinpoint the condition. Your healthcare provider will take a person's medical history, including checking for family members that may have been diagnosed with Parkinson's in the past. It's important to note here that there are both genetic factors and environmental factors that can determine if your risk factors for developing Parkinson's. Your healthcare provider will perform a thorough neurological examination to assess your motor and sensory skills. Imaging scans such as MRIs and CTs may also be requested in order to rule out other ailments which could feature similar symptoms. And definitely there's a blood test and a urine test will be done to rule out other medical conditions that may have Parkinson's-like symptoms. So let's talk about treatment for Parkinson's disease. If you're living with Parkinson's disease, there are various treatment options available to help manage your symptoms. Medication can be taken to replace the dopamine that is lost in the brain. Deep brain stimulation may also be used by sending electrical signals into the regions of the brain that are around the affected areas, which helps control involuntary tremors and controls movement. For some severe cases, surgery may sometimes provide relief if it's needed. But although I have to tell you, this type of procedure has become less common since treatments such as deep brain stimulation have been developed. And that's a good thing. That's amazing. So, what are the complications of Parkinson's disease? Parkinson's disease, as I said, is a progressive condition that affects mobility, cognitive function, and mental health. Many suffer symptoms along with sleep disorders. Initially, it might cause symptoms such as tremors or a slowness of movement. However, over time, memory problems can develop, leading to dementia in some individuals. This form of illness often brings challenges when it comes to communication, problem solving, and understanding abstract concepts, thus making basic activities of living, like independently, increasingly difficult over time. So let me talk about Parkinson's disease dementia, or PDD. Parkinson's disease dementia is a decline in a person's thinking and reasoning skills. These symptoms may be exhibited in some individuals living with Parkinson's disease. This may occur in the early stages, but at least a year after receiving a diagnosis. The brain changes caused by Parkinson's disease during the disease process begin in the region of the brain that controls movement. And as I said earlier, the common symptoms or the early symptoms include the involuntary movements, muscle rigidity, a shuffling step that causes balance problems, and many have a lack of facial expression because the muscles that work the face are in the part of the brain that is being negatively impacted. As brain cells change and Parkinson's gradually spreads, a person may also experience changes in mental functions. These non-motor symptoms include problems with memory, diminished ability to concentrate, sleep problems may occur, and the ability to make sound judgments becomes impaired. A person suffering from Parkinson's disease may start to have symptoms similar to dementia. They start to have moments when they are unable to complete simple tasks. Parkinson's research has shown that brain damage occurs as abnormal microscopic deposits composed chiefly of alpha-synuclein start to build up in the brain. This is the protein that is found in the brain cells. Researchers believe that these Lewy bodies are problematic because they pull alpha-synuclein protein out of the nucleus of the cells. These deposits are called Lewy bodies, named after Frederick H. Lewy, MD. He was the neurologist who discovered them while working with Dr. Alzheimer's in his laboratory in the early 1900s. Lewy body, the buildup of Lewy bodies cause changes to the brain. These cause certain symptoms that can lead to dementia in some cases. And this is where things can become challenging, not only for the Parkinson's community, but also for medical professionals. There are two major types of Parkinson's-related dementias. Parkinson's disease dementia, or PD, is a form of dementia associated with Parkinson's. It is characterized by progressive movement issues and impaired thinking skills. Then, as I mentioned before, there is a dementia with Lewy bodies, or DLB. This type of dementia shows signs of cognitive decline first. Those suffering from Parkinson's disease experience the motor symptoms before experiencing any changes in their thinking processes or behavior. Lewy body proteins cause changes to the brain and can lead to dementia in some cases and are responsible for more than just dementia with Lewy bodies. A recent study indicates they might be linked to with Parkinson's disease as well as the Alzheimer's-like plaques and tangles that we talk about. This has been found in the autopsies done on the brains of individuals that have suffered with movement disorders and neurological disorders. Individuals have been found on autopsies after death to have Lewy body dementia, Alzheimer's dementia, and a form of vascular dementia. This is called mixed dementia. The study I mentioned earlier examined the cells of living mice as well as post-mortem brain tissue in humans. It learned that these proteins perform an important function of repairing breaks that occur along the strands of our DNA present in the nucleus of every single cell of the body. The alpha-synuclein roles in the DNA, that protein I talked about, the role in that DNA repair may be crucial in preventing nerve cells from dying. This function may be lost in brain diseases such as Parkinson's and dementia with Lewy body. The loss of this function leads to the widespread death of nerve cells as well as brain cells. Additional risk factors may include if a person is experiencing hallucinations and does not yet have other dementia symptoms, may have an increased chance of developing dementia. If a person is having sleep problems with excessive daytime sleepiness, they may develop a Parkinson's-type dementia. A Parkinson's symptom pattern known as postural instability and gait disturbance, PIGD, includes freezing in mid-step, difficulty initiating movement, shuffling, and problems with balance and falling. Symptoms of Parkinson's disease include difficulty with memory, judgment and interpreting visual information, muffled speech, and even visual hallucinations. Some will start to exhibit delusional thinking. A delusion is a belief in something that is not real. Individuals start to feel paranoid. They may falsely accuse others of stealing or taking their things. They start to become depressed, irritable, and anxious. They will experience increased drowsiness during the day, and this leads to sleep disturbances like REM disorder in some cases. So to properly diagnose Parkinson's disease dementia or dementia with Lewy body, DLB, medical professionals follow specific guidelines. They look for the presence of changes in movement, such as tremors, that occur at least 1 year after the onset of symptoms. That's an indicator for PDD. However, with DLB, or dementia with Lewy body, it is possible to experience dementia before or simultaneously with these movements occurring within a year from symptom inception, making this diagnosis more challenging when compared to its counterparts. Earlier diagnosis is important for both diagnoses. It's important to be accurately identified so patients can receive proper treatment. So let's talk about treatment for Parkinson's disease dementia. Unfortunately, there currently is no way to slow or stop the brain cell damage caused by Parkinson's disease dementia. However, there are numerous strategies are being pursued in order to improve symptoms and help those living with this condition manage their everyday lives better. If medications have been described as part of a treatment plan, it's important to stay connected with your doctor regularly so they can identify which drugs work best for you and at what doses. I want to talk about cholinesterase inhibitor drugs, which are already widely used for Alzheimer's patients, may be as helpful when it comes to treating visual hallucinations, sleep disturbances, and changes in thinking and behavior related to PD or Parkinson's disease dementia. Similarly, carbidopa levodopa therapy may be given, but with due caution, they must be taken because these symptoms sometimes aggravate confusion and hallucinations, especially if combined with dementia with Lewy body. Lastly, deep brain stimulation, DBS, has shown promise as a potential advanced therapy option for managing symptoms associated with PD2. When dealing with depression, a common symptom in Parkinson's disease dementia with Lewy body, DLB, selective serotonin reuptake inhibitors, SSRIs, is often the go-to medication for treating depression. For individuals that suffer from sleep disorders, such as REM disorder, doctors prescribe clozapam or melatonin instead of antipsychotics like Haldol, or in individuals, because individuals that are diagnosed with PD or DLB have been found that 60% of those who take these drugs experience worsening symptoms such as sedation and impaired swallowing. Many Parkinson's disease and other medications can cause or worsen confusion and hallucinations and may need to be reduced or eliminated with a doctor's guidance. These include certain dopamine-boosting medications, which help movement at lower doses, but may worsen thinking problems at higher doses, and anticholinergic acetylcholine-blocking medications, such as trihexyphenidyl, sometimes is used to treat tremors. Some bladder medications, older antidepressants, and over-the-counter drugs that contain diphenhydramine, such as Benadryl, can also cause a negative impact on an individual's thought processes. It's important to be mindful of the potential side effects when managing symptoms with prescribed medications. An optimal approach is to start out at the lowest possible therapeutic dose and gradually increase while keeping an eye on both positive and negative responses, and then reevaluate if further use is necessary. Before starting any new medication, especially for Lewy body, make sure you've done your homework by researching about it and talking through the risk versus benefit with your doctors so that together you can develop the best plan of action. Many patients, Lewy body dementia patients, may have an opposite reaction, also called a paradoxical effect, to the medications given. For example, the medications meant to calm and quiet may result in increased agitation and aggression. So please take this tip to heart. Start at the lowest possible dose, then observe. Learn to keep a journal so you can track dosage and responses to that dose. I'd like to now talk about non-drug approaches to PDD. Improving the quality of life for someone with dementia does not always require medication management. Cognitive training, behavioral intervention, and stimulating activities can help build upon their strengths and interests to increase well being. Activities should be tailored towards the individual, decluttering living spaces, providing plenty of light, or adjusting routines around sleep, meals, and exercise are some examples that may reduce any confusion or discomfort they feel in unfamiliar surroundings. Games, puzzles, and other activities that cater to a person's unique interests could also have more lasting benefit than forced memory brain games. Social connections also provide a meaningful source of support during these difficult times. Let's talk about tips for the family caregiver. Caring for a loved one with dementia is taxing, so don't forget to take time out and prioritize your own well being. Speak simply and gently when engaging them. Be understanding of their situation while keeping open lines of communication with the care team. Remember that relief begins by finding solutions together. Start now to uncover vital resources like health aides or long-term care options, which may make life easier down the line. Get in touch with others who have faced similar experiences through support groups or counseling sessions. You're not alone. This has been brought to you by caregiverrelief.com.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.